because I haven't been to I haven't been to the Wednesday nights in a while. So what is the time frame for the presentation that you all want?
We generally keep it about 30 minutes, if
Okay,
that's
so
possible.
we had around stop around 7ish. Okay,
Around 7-ish, yes.
perfect.
Hi, Jane and Margaret, welcome.
Hi.
Hello.
Well, I think we know everybody, most everybody, but we can still just briefly introduce ourselves. I'm Frank and Jennifer Clark. Frank's a psychiatrist and I'm a psychiatric nurse practitioner. And we work at Prisma Health, and we've been in mental health field for a good bit. I don't know how I've been in as a psychiatric nurse for about 18 years, and in an NP for about 13 to 14 years. And I mainly work in the outpatient setting. Frank, you want to?
Sure. So good to see you all. Excuse me. Let's see, I guess I've been in psychiatry between residency and now as an attending, probably, I guess it's been 12 years, and enjoy it. I used to do inpatient at Marshall Pickens. I was the medical director there for about 4 years, and did some teaching with the residents and medical students. But I decided to make a change after turning 40. I had to do some reflection, and was a little burned out. So decided to move to the outpatient clinic. And so that's where I'm at now, still working for Prisma and doing outpatient in Greer, and still being able to teach and with residents and medical students. So, yeah.
Well, first of all, I mean, the topic is mental health in the pandemic, and we were asked to just kind of share or talk about that. But really, we thought it might be helpful to just kind of, if y'all are willing, is there anything you all have in mind in terms of what we talk about, in terms of the how the pandemic has affected just mental health in general, things that you've struggled with or seen families struggle with in terms of just isolation aspects, or just not being able to be as active in our faith communities like we were before. Anything that y'all want to share or want to comment on, and then we can kind of expand on that. Let us know. Oh, I think he was unmute there. Yeah.
I'm looking for any kind of suggestions for survival techniques for getting through this successfully with as little damage as possible.
Okay.
And survival from a mental health standpoint, is that what you're saying? Yeah. And I don't know, maybe we're not the best people to be talking. We're going through it too, so we're just trying to deal with it. But I think the key is looking at reducing isolation in any way you can. And so, and for us, we have this conversation probably on a weekly, daily basis about risk and benefits. And so it changes as these variants emerge. Sometimes we feel more comfortable and we'll be at church or do things, and then we kind of hibernate again. And so looking at keeping yourself socially engaged, even if it is through Zoom or through select in outdoor settings, kind of looking at because things that we may consider acceptable, someone in their 60s and 70s maybe feel like it's too risky, and so we have to, in our health conditions, or if you're caring for an elderly parent or someone going through chemotherapy, your risk level is going to be a little bit different than maybe mine per se. So it's all looking at that and trying to have a balanced view. I think it's also unhealthy to be, I know actually my brother would be an example. Just that very restrictive view. And yes, he has a wife who has some abuse issues, but they have not went anywhere in 2 years, pretty much. They don't do anything. And I think that's negatively affected their mental health. I understand it. But then, so trying to look at that balance. You want to add to that, Frank?
Yeah, I definitely, I would agree with everything Jennifer said. We do have this conversation probably weekly because, and even with us, we have, so, and self-disclosure, we all had COVID recently, actually.
Right after Christmas,
around New Year's. I was probably the one that was the person that gave it to Jennifer.
No blame.
And then Clara got it, and then my in-laws got it as well. So I think it is important to have a balance, and we weren't created to be isolated. I think we have to be mindful of that. I think it's also important to make sure that whatever decision that you make, that you try not to worry about others people's decisions and what they're doing, because I think it's easy to start comparing to like, oh, so and so like went out to the Clemson or Gamecock football game, and it's like, oh my God, I can't believe they would do something like that. And what I was telling Jennifer, like, even though like I'm a huge sports fan and I haven't been to a professional or college sports game in a while, probably because of COVID, but that's just something that I choose not to do. But I think it's important, like if individuals, sometimes I think people, like, we don't understand why they may be doing what they're doing, so like with the sports example, maybe a game is what's going to help that person get out of depression. Because, and it's like, okay, if that's something that person needs to do, who am I to judge and say that's the wrong decision? I think everybody has a level of risk that they're willing to take. We have season tickets to the Peace Center, and that's something that we enjoy doing because what?
Oh, no, I'm just saying, and yeah, that's another one of those things that we kind of debate about, because it's risky. There's a lot of people there. We did go before the Omicron variant. I think we're going to go in a couple of weeks and wear masks, and it's kind of one of those things. It's risky, and I struggle with probably more so than Frank. I think I struggle with that decision making of are we making the right decision with things, and that's an internal struggle, I think. And also kind of looking at, sometimes I even felt this way when we got COVID. It's almost like some people consider it like a moral failure, like you did something wrong because you got COVID or something. And I'm trying not to look at it that way. We're going to it's what it is. It's a virus. And so just trying to make the best decisions. But I think, as we are trying to be more, be safe and things like that, trying to keep yourself as engaged as you can, even if it's in small groups, even if it's virtual, whatever keeps you going. I think there's just this almost inclination now that we're more. Oops, we have a little visitor. Claire, you want to say hi real quick?
That's okay.
Let's
you can say hi, and then you got to go. Okay. Say hi.
Hi,
Can you
Claire.
say hi, people?
You say hi.
Hey, I think she's good for her mental health to see her cute face.
Okay. It's time.
I'm gonna let you talk for a second. Okay, give me a hug. I'm gonna give her some butterflies.
Okay.
Okay. Let's go. I got you. Oh, bye. Here.
So yeah, I think our mental health is definitely been compromised with this pandemic. It was interesting. I was hearing a talk recently, this past weekend, at the South Carolina Psychiatric Association meeting, and they were talking about COVID impact on various age groups. And one of the studies actually found that individuals, so youth have actually had a harder time than the geriatric population. And I actually thought, I was actually surprised, but I wasn't surprised by the youth, but it was just talking about, like, in the geriatric population, there was a lot of resiliency there. And part of that is probably just because as people get older, they've been through so much, and it's kind of like, okay, well, we've seen this, we've seen that, we've been through this. And so that's not to say that the geriatric population is not suffering, because they are. I mean, my mother is in a memory care facility, and it can be very because she has dementia, and it can be very isolating when you're used to at least going out on outings and other things. But I think it's I try to look for the silver linings during this pandemic. For me, I've been able to write more. I enjoy writing poetry, and I think I would encourage you all to think of, if you haven't already started doing this, pick up a new hobby, and I think that it can be, I don't know, I think everything happens for a reason, and in some ways, I wonder if the pandemic has been God's way of us saying to slow down, because we are all so busy and we just keep going and going. I think it's, at least for me, and I think for Jennifer as well, it's allowed us to do some more reflection on what's really important. I can tell you at the hospital right now, it's last week was a little emotional, this because we were getting consulted to see people who were very confused related to COVID. And, these are people who are getting ready to go into hospice. And I just, it hit me in a different way, just because you just don't know, this virus has impacted people in various ways. But I would encourage you all to maybe pick up a new hobby. It's okay to be angry. We talk about this pandemic anger, and that's a real thing. That is a real thing. I think a lot of people are angry at the fact that, we thought maybe we would be through this pandemic, maybe, over a year ago, and we're coming up on 2 years in March, I believe. And so, I don't think if you would have asked us like, okay, would we still be in this pandemic, 2 years? I think people would just say, no, and so I think there's just a lot of anger, and I think it's
And
so,
a roller coaster of
Yeah,
emotions.
yeah.
Like, we get through the Delta variant or through it and we think that, okay, we can start doing things and these boosters are available, and then Omicron variant hits. And so just kind of these managing expectations a little bit.
and I think the other thing would be too, in terms of survival, which was mentioned, try to do your best to avoid the news.
Small doses.
Small doses, yeah. And I say that because there's a lot of misinformation and disinformation. And whether it be, and we're not here to get into a discussion about whether you should be vaccinated or not. That could be its own talk in itself. But I think that people are very frustrated right now with, there's so much, should we wear a mask? Should we do this? And are the numbers really real? And so what I share with people who have any concerns about COVID, I show them the numbers in our hospital system, because we get the numbers every day. And I will share with them, this is what's happening in our hospital system, and this is how it's impacting people. So you have to make the best decision for yourself and your family of what measures you want to take. If you feel comfortable, like there are people I have friends that fly right now. I mean, they're not just for work. I mean, they're flying for leisure. And, I flew after a while, and that was probably risky. But, Jennifer knows about me is that, I take my mental health very seriously. And as someone who, and I think I've probably mentioned this when when we've shared things with you guys before, I went through my own depression in medical school. And so I'm very mindful of what I need to do to keep me well. So Jennifer knows I enjoy going to the gym. Now, she'll probably give me a side eye at times and say to you, could I work out at home? I absolutely could. And I have, but I crave socialization. I crave group. I need to see people. So what do? I wear a mask when I go into the gym. I take it off when I work out, and afterwards I put a mask back on.
It's necessary.
It's not, so I think looking at what are the deal breakers for your mental health, if going out, once a month on your date nights to that favorite restaurant of yours is going to be, meaningful for you and continue, then do it. I think you just have to
compromise with
yeah.
a heated patio outdoors, whatever you feel comfortable with. Yeah.
Other questions?
Yeah.
Or thoughts?
Frank, what are the numbers in the hospital looking like right now?
Oh, the last number, that was a couple weeks ago. I think at one point we had 500 cases or more, and they break it down to the number of people who were vaccinated and unvaccinated. I can say that we have more people in the hospital who are unvaccinated, and then they also break the numbers down in terms of those individuals who are requiring ventilators. And the majority of people who are requiring ventilators are the individuals that are unvaccinated. So the numbers, I think, maybe going down a little bit. but every state's going to probably have their peak. But I can tell you that I mean, it's hit our department. It's hit Prisma hard. I think at one point somebody said we had like over 400 employees out. Us being two of them. We have colleagues right now that are out with COVID. So I think Omicron, it's one of those that it's highly transmissible. And I mean, I'm thankful that if we had to get one variant, I think we got Omicron. I don't think we had Delta. We had very mild symptoms, but Delta hits more it hits the lower part of the lungs, whereas Omicron hits the upper part. So you don't get as much of the respiratory things. But with that being said, we're relatively healthy. If you have someone who has chronic medical conditions like diabetes, obesity, high blood pressure, the outcomes may not be the same. So.
Mm-hmm.
So how are you guys doing though? In all honesty, I mean, what sorts of feelings have come up for you during this pandemic?
I think we're doing pretty well. I think we see the light at the end of the tunnel. We were isolated because all our kids live away for last year a lot, but things let up this summer, so we get to see everybody, and that really helped. We're worried about our grandkids, the social isolation, for all of them. From the college age kids to the elementary school age kids. That's a real concern for me.
Sure. And I think I've even noticed just in myself that you almost get, I have my social interaction in the sense I see patients mainly virtually, though. A lot of my patients are virtual, so it's kind of a different interaction. But so I do have that interaction. I have my family interaction, but you can almost get used to not seeing people, right? In terms of just, because we haven't been to church a lot because of Claire. We're kind of changing that now probably, but we just haven't been around a lot of people. You almost get used to it. You kind of get complacent. And something I've missed that used to be a big part of my life was just service in terms of volunteering, whether it was their junior league, because a lot of your volunteer activities are in groups or in person, and I haven't really done that in a couple of years. And I think that's something I've noticed that I've lacked. And just I'll admit that I've struggled some spiritually in the sense that I've not been present at church. I think that's affected me because Frank does a much better with the virtual stuff in the because it's hard for me too with her. She's not going to listen to virtual church well. So we put it on with good intentions, but I'm running around chasing her. So I think that's impacted me some. So I think because when we're not in our groups and, organizations, sometimes that can affect us in certain ways. I don't know if y'all identify with any of that or not. Mm-hmm.
Yeah, I have tended to vacillate between. I think the best way I can probably sum it up is that I think we're all grieving at times, and there's so many stages of grief. You can go through that anger phase, which I've been in. You can go through the acceptance. You can go through the denial, the bargaining. But I think I've come to the conclusion that I'm at the stage of. I was telling Jennifer, I'm like, this virus is not going anywhere. Now, I don't think we're going to be in a pandemic forever, but I mean, COVID is here to stay. I mean, it's going to be around. So I've kind of started to rationalize a little bit and just kind of say, okay, it's going to be around. So I want to make sure we're taking all the proper precautions, but how can we still live our best life and still find things that are meaningful? You talked about the youth, Catherine, and these numbers may not shock you, but the rates of suicide have increased, and that was even before the pandemic. But and I don't have the latest numbers offhand, but we, especially with kids, kids are used to being in environments where they can socialize. And I mean, we were in grade school. I mean, we know what that means. We know what it means to see people. And I think the youth are struggling. And not just youth, I mean, even adults.
We see patients on a daily basis who have been really affected by the isolation of the pandemic and things like that. And even just, I see a lot of, I do some perinatal psychiatry where I see pregnant and postpartum women. So a lot of the moms I see, are impacted with the stress of like the schools are being closed because of quarantine, or they have to quarantine their kids. So they're trying to work from home and manage kids at home, and, just a lot of stressors.
Yeah. And I think, I think our society has lost the ability to see humanity, and we've just, people are just not being kind to one another. I can't tell you how frustrating that is, because it's, and obviously we have kind people, but it's just very frustrating. I mean, you get into these discussions with, I feel like COVID has become very, polarizing, which I think is also, like, I've never heard of a virus being political. I've just never heard of that. Because the virus doesn't care. It doesn't care. And we have to wake up as a society, because it's very sad. People's relationships have been severed over this. If you ask somebody to put on a mask, they may look at you with a side eye and say, well, this doesn't make sense. So I think we have to be willing to be, to remember to be kind to one another, even if you have a differing opinion on the virus, the vaccines, or whatever. Just be respectful of people's opinions. We don't have to agree with everybody, which it would be sad if we agreed with everything that people say, or they agreed with us. But we've just lost that ability to see humanity, and I think that's where some of some of my anger comes in. I think with the pandemic, it's not so much about the virus. I mean, I've always probably become, and I can admit this, I've probably become a little desensitized at times. I think that's just part of my defense mechanism and things like that. I know it still impacts me, but I'm just kind of like, I try not to watch the news. I just try to be present, and just thank God for, Jennifer and I talk about that every day during our prayers. I'm like, we just got to thank God for what we do have. We still have jobs. A lot of people don't. We still have a home. A lot of people don't. There are a lot of people that have become homeless because of due to COVID. They've lost jobs. We still have the necessities to help us, live a good quality of life. So whenever I start to get angry, or we get angry at each other, we think about the big picture, and because at the end of the day, this won't be the last pandemic that's going to happen. There will be another pandemic, I'm sure, and I don't know what that will be, but there's something to be said about resilience. There's something to be said about remembering that God is still in the control, and knowing that He's with us. And I just try to keep that in mind.
Yeah. I think we are close to 7, about 2 minutes. Is there any other questions or comments? Any other final things? We could probably talk about it for a really long time, but so 30 minutes isn't a long time for this topic. But anything anybody wants to say?
Just one thing you said that struck me about, the longer the pandemic goes on, I think in the beginning I just kept waiting for things to go back to the way they used to be. And, now I think I've accepted that they will never be the way they used to be. So you have to get to a way of making a new life that works for you. And I liked what you said about the risk benefits and, what's valuable to me might be different from what's valuable to somebody else. So
Yeah, and
I
it's, you know, it's
appreciate the
different.
insight.
It's different for everybody. And, you know, I think the hardest part, I don't know about you all, how you all view this, but for us, like the beginning, when we didn't know, when the COVID, when the first strain came out and it seemed very, very deadly, and it can be, but you know, where the vaccines weren't available, you know, we didn't see my parents for like, we're used to seeing them monthly. We didn't see them for like 6 to 8 months or something before, or maybe longer, until like the vaccines came out. We didn't see them because they live in Tennessee. But now we're able to see them regularly. So some of that was like the hardest time for me. I mean, not to say it's not still hard now, but at least, you know, we've had a little more semblance of normal life, a little bit more assimilation of things with the vaccines. At least we've done a little bit more in our lives, but still using precautions and things like that. But yeah, I think the balance of things, and that varies depending on the time and depending on the person and all of that. Yeah.
Great.
One question I have is,